Assalamu alaikum. Recently, news has been going on about the outbreak of the Nipah virus infection in India, which has already been tested positive in 6 people and 2 of them have already died. This is a kind of virus which infects the brain. It causes swelling of the brain, it causes encephalitis, and it causes flu-like illness, and the mortality rate is very high, between 40 to 75%. Therefore, we must know about the disease. Although there has been no confirmed case in Pakistan as of yet, but we share boundaries and there is frequent travelling. Therefore, it is necessary to take all the precautionary measures. I'm Dr. Mariam Ateek, and let's talk about the Nipah virus disease. What are its causes? How is it transmitted? What are the symptoms and what can you do about it? It is an emerging zoonotic disease. That means it is being transferred from the animals into the humans. And it causes a severe disease with fatalities both in the animals as well as in humans. The very first cases were isolated in 1999 in Malaysia and Singapore, when a group of the pig farmers and the people who were dealing with these infected pigs were affected, and they presented with encephalitis, that is swelling of the brain, and flu-like illnesses, and the fatality was high. Then in May 2018, India presented its first cases, and there were 36 cases, out of them 11 died, and now again 2 people have died. So what is it? This is basically a disease which is produced by this Nipah virus, and this virus is a natural host in the flying foxes. Those are the fruit bats and the pigs. From there, how is it transmitted? It is transmitted directly to the humans from these infected animals. Then there can be the transfer from the food and the water that has been contaminated by the bodily fluids of these animals. Bodily fluids like blood, like saliva, like urine, etc. And thirdly, once it travels into the humans, it can be transmitted to other humans again by these bodily fluids and by the droplets that are coming out of the mouth and nose when one coughs, when one sneezes. Then there is a fourth case. As it is highly infective, it gets transferred while the people are in the hospital, and they can transmit it to the other people who are normal and who are visiting there for other problems. So what can you do about it? You have to understand the symptoms. Now this presents with a normal fever and headache, but then there are extreme body aches, muscle pains, leading to nausea, vomiting, and later on when the brain gets involved, then there is dizziness, then there is disorientation, then there is confusion, there may be seizures, and sometimes when it is not being treated or we do not understand, that the patient can go into coma within 24 to 48 hours. On the other side, what will be the respiratory symptoms? It has flu-like symptoms. So there will be cold, there will be cough, there will be breathing difficulty, their pneumonia can result, there can be an acute respiratory distress. All these things are the common symptoms which are shared by so many diseases. Therefore, it is difficult to isolate that what is the cause here. But then a strong history tracking will tell you that these are the people who are living in areas where there are lots of fruit bats, or they are working with the pigs. They are having those farms. So you have to be careful. Now what to do about it? It is a viral illness. As of yet, we have no definite medicine against the disease. We have no vaccination that has been found. But it is getting stronger and stronger by the day, and WHO is looking deep into it, that we need to develop measures, because like corona, it can go into an epidemic state. It is already endemic in Southeast Asia. So what you have to do? Well, you have to consult the doctor if required. If there is a history which is relating, tests will be ordered to isolate the different viruses that may be causing it, and you will be given treatment according to your symptoms. If there is fever, that will be treated. If there are allergies, if there is cold and cough, all those medicines will be given. And similarly, what you can do on your part, you need to do your own thing. If such symptoms are there, first of all, you need to isolate yourself. Why? Because if there is an exposure to these infected animals or to their droppings, etc., the bodily fluids, the disease will take about 4 to 14 days to start its symptoms, and then it will take another 3 to 14 days to get over with it, unless it is going down the wrong way and it is going to prove fatal. So you have to isolate yourself if you are exhibiting such symptoms. Try to eat a healthy food, try to stay hydrated, cover your nose and mouth when you are coughing and sneezing. You know that you have to cough into your elbows, and similarly, if you are using your tissue papers to wipe off the nasal secretions or you're coughing into it, you have to dispose them properly. You have to lock them up in a cellophane bag and throw them. The health personnel who are dealing with them, they need to have proper personal protective equipment. They need to wear their gloves, they need to wear their masks, they need to wear their goggles, and similarly people who are coughing and sneezing, they should also wear their masks. Their bedding, their linen, that has to be kept separately, it has to be washed separately, and those who are dying, even their burial has to be done separately, so that the people who are dealing with it do not get infected by coming in contact with the bodily fluids. So please keep these things in your mind, and if you have anyone who is traveling from abroad who is exhibiting such symptoms, please isolate them, quarantine them for 21 days, consult the doctor and stay safe. I hope we do not land into another epidemic. Thank you and have a nice day. Assalamu alaikum.